All right, everyone, it's Dr. Dan Ritchie, president of the Functional Aging Institute, and today I have with us Dr. Emily Splichal of the Evidence-Based Fitness Academy. Really excited to have her on, as she has really been at the forefront of barefoot training, barefoot technology, and actually spoke at the very first Functional Aging Summit in 2015 in Phoenix, and really kind of opened a lot of eyes to why we need to be looking so much at people's feet. So Dr. Emily, I will let you take it away. Thanks so much for sharing your time and expertise with us.
Of course. Thank you so much. It's always a privilege to be working with FAI, and thank you to everybody who is tuning in live, and if those who are listening on the recorded version of this, thank you as well. So we're going to be talking about fall reduction, which is a huge kind of hot topic when it comes to senior fitness, baby boomer fitness. It's a large passion of mine, and I build a lot of my education around understanding proprioceptive training, specifically towards fall reduction. We're going to be taking a deeper look at fall reduction and proprioception on how it relates to locomotion. And that's really how I look at this side of senior fitness, if you want to call it that. So before we jump into it, real quick for anyone who is not familiar with who I am, as mentioned, my name is Dr. Splichal. I'm a podiatrist in New York City. I'm also a human movement specialist. I am a clinician by day, but spend a lot of my time consulting and educating, writing, and developing programs built around how I look at the foot and ankle and the integration of the foot and ankle in human movement, where the specific aspect of human movements that I am passionate on is in locomotion. So the development of locomotion all the way towards age-related changes in locomotion and what we can do to enhance that programming. So as mentioned, my company is EBFA Fitness. I just launched a new product called Naboso, which I'm going to be speaking about. All of these things linked through my website, which is EBFA Global. So we are going to jump on into it. If you guys have questions, please do type those in. As was mentioned, we'll go through those at the end. So very important thing when it comes to fall reduction programming is that I want us to understand and to grasp that a lot of falls are actually happening during locomotion. And there are specific changes that happen to the way that we walk as we get older. Some of these key changes in our gait, which are greatly contributing to falls, increase a decreased walking speed. The slower you walk, there's a direct correlation or inverse correlation to the fall risk. Another thing that was noted is that as we age, we start to see an increase in stride variance, where if you have, a shorter step on one side and then a longer step on the other side, so it could be an asymmetrical stride, that's going to contribute to it as well. Or it could be, step 1 and 5 are mismatching in that stride length and the stride speed. So there could be speed changes as well during an aging gait pattern. We often see an increased time in double leg stance. The reason for that is we're obviously more stable when we're in that double leg stance. You have more contact with the ground. You're not requiring that single leg stability, which is really a key feature when it comes to optimal gait. Many aging baby boomers start to become apropulsive, and then a key thing that I focus on is all of these changes, including apropulsive, you become less fascially elastic. The big thing when it comes to locomotion and gait is that it is very subconscious, very automatic. I'm going to speak about that very soon, what's called the automaticity of gait. So your gait is automatic. Your gait is also very like a rubber band. So trying to think of, okay, the fascial rubber band elasticity of my client is key to reducing their falls. As I start to decrease my speed, my stride length has to shorten. To truly tap into the elasticity of gait, thinking like rotations and spirals to the body, you do need an optimal stride length. This is huge. a majority of my senior patients who are starting to get these different injuries and compensations, when I look at them walk, they're taking these very staccatic steps where they have no T-spine rotation, no pelvic rotation, their SI joint is locked. So that's of course going to take away that fascial elasticity side of things. Remember that your fascia is extremely sensitive with tons of proprioceptors, small nerve proprioceptors, which means that the more you can tap into your fascia, the more proprioceptive rich your gait will be. That happens to not be the focus of what I'm speaking about here. I'm talking about a different aspect of proprioception, but just know that as well, that the sufficient stride length and elasticity of gait really is also how you tap into proprioceptors. Key thing that we're going to focus on here is switching from this automatic to an executive type gait. So automaticity of gait, this is key. This is really what you want to be thinking about with your clients. Still think about the rubber band fascial side, but this is going to be another side. When you can achieve steady state walking, so think very sinusoidal, very rhythmic, that's going to help you start to fall into this automatic pattern, the automatic pattern that also lies within your connective tissue. As we age, we start to shift away from this automaticity of gait and we become much more executive. We're going to talk a lot about this executive side of gait, where there always is an executive side or a cognitive side of gait. That's where, if you've ever heard kind of it's now, a little bit more to the forefront, the art of dual tasking. So when you're walking, you must be able to prioritize the walking pattern and all the proprioceptive information coming in through gait with other cognitive decisions, whether it's holding a conversation or recalling, where you have to go or trying to navigate an obstacle or whatnot. So that's going to be a key change here. So why gait is designed to be automatic is that your nervous system was really shaped to walk. If anyone follows any of DNS or reflex locomotion, you can actually start to see these primitive patterns in a newborn child, and into the shaping of the nervous system really does feed for reflexive locomotion. They actually see that if you have spinal injuries, and in different animals that they have spinal cord injuries or they'll sever the spinal cord, that they can still create reflexive movements in the limbs that mimic gait. So part of walking is actually spinal subcortical side of it, that you actually don't necessarily need CNS processing for all aspects of gait. When we look at other aspects of gait, the cerebellum, of course, that's kind of your balance side of the brain. That needs to be in tune as well. And anytime you think about automaticity, I want you to think that it is fast. So these are reflex pathways. Whenever I talk about proprioception, I also speak about how it's fast, how it's reflexive. When I speak about fascia, fascial sequencing is fast, it's reflexive. So all of these things are fitting into really how our locomotion is designed for optimal patterning or optimal motor control. Now, there's always a balance, as I had said, between this automatic side and the executive side, okay? As soon as we start switching to be more executive and more cognitive, now we're actually switching into a slower process. This now becomes a little bit higher up in the brain. It takes time. We can only process so many things at a time. So if we're trying to be too cognitive in our gait, then we don't have space or time to be processing other information, such as navigating an obstacle, or if you see, that there's something narrow, or there's water or ice that you have to avoid. If you're so cognitive in just taking the first steps on the normal floor, and now you have to somehow make the decision of how you're going to walk on this slippery surface, you've already maxed out your executive room or capacity for that. So then that slows down even more. So this is really where dual tasking comes in, is that balance between automatic and cognitive. How good are you at balancing those two sides of gait? And there's different cognitive automatic decisions or balances that are considered either low cost, like a dual task cost is either low or high. Really where we focus on determining if our client is good at doing dual tasks has to do with their prefrontal cortical activity. And this can actually be traced where, let's say in the gym setting or with your client, how are you going to assess their ability to do a dual task? This is usually you asking them to do some sort of complex memory recall, or it's usually mathematic problems. A lot of the research on dual tasking will say count backwards from 100 in multiples of 3, and then they'll measure their medial lateral sway as they're doing that. That would be you testing your client's ability to dual task and balance the proprioceptive cognitive side of balance and stability. The other way that people can look at it, or researchers can look at it, is they can actually look at it under brain activity. So they're using a type of MRI and looking at how much the brain is lighting up in that prefrontal cortex. When we are learning new skills, even if we're younger and they're looking at someone young learning to drive for the first time. And I'm sure we can all remember when we first learned how to drive, or if you don't drive a lot and you're trying to manage and then you forget to look in a certain mirror and you're trying to navigate all these things and there's so many things to balance. You're in a very prefrontal state. And then as you get used to driving, it obviously becomes more and more automatic. So it becomes less prefrontal. As we age, our prefrontal activity increases during GAIT. They can actually track this through MRI activity, and they see spikes in the prefrontal activity when the seniors or the older individuals are starting to make decisions on changing speed, or they see obstacles that they have to get over, or they're doing some sort of dual task. They can actually see that increase in prefrontal activity. So if their brain health was capable to handle that prefrontal cortical activity, you might not see a large disturbance. However, unfortunately, as we age, the brain ages as well, and we actually start to see a demyelination and a decreased neuronal activity in the prefrontal cortex. And then, so if you are trying to get more feedback from the prefrontal cortex and you have less to work with there because of an aging brain, then you can start to see where these fall risks are happening. So what I want to focus on is not how can we change the cortical prefrontal cortex side of things. That's a whole other element of fall reduction programming. I want to focus on how we can reestablish the automaticity of GAIT. So can we go back to more the sensory information that you're bringing in for your clients and just acknowledge and respect that there's the whole cognitive side. So yes, there is dual tasking, but when we start exploring dual tasking, the most important thing is that your sensory input is preceding the cognitive side of things. So sensory is going to be your foundation layer 1. So we're going to be focusing on how can we reestablish that automatic GAIT pattern, the subconscious GAIT pattern in our clients. Understanding the things that affect and take your clients away from an automatic GAIT pattern is important. Of course, CNS injury, if they had a stroke, that's massive, right? That's huge. I understand that. If they start to get Alzheimer's, Parkinson's, MS, there's a lot of central nervous system or upper motor neuron conditions that can contribute to this. Know that and respect that, right? That's definitely going to affect their fall risk and their GAIT pattern. Focus here, proprioception and that tactile somatosensory side of things. And that's what we want to focus on, is what happens to the peripheral proprioceptive system and their ability to perceive textures and tactile feedback to then increase their control during GAIT, therefore decreasing their fall risk. Okay? So, and then a part of that could be still tracking the dual tasking. So there was a study that saw that the dual tasking ability became more impaired in subjects with neuropathy compared to subjects without neuropathy, which means if you have 2 clients, one has impaired proprioceptive input, the other one normal proprioceptive input. The one that has lost their peripheral proprioceptive input has an impaired ability to dual task, When you look at dual tasking, as I had said, the foundation has to be the sensory input. So if you're doing balance training right now and you're doing memory recall and you're having, some sort of cognitive side to them balancing, but you haven't focused on enhancing the peripheral proprioceptive input, you might not be getting the results that you need because you need that sensory foundation first. So we're going to take a little look at haptic or tactile exploration. So this can be both for the hand and for the feet. We're going to be talking about both. When it comes to haptic exploration, or this ability to perceive things through touch, there's two key areas that you would test in your clients or in your subjects, your patients, is the ability to detect rough versus smooth. So that's a texture element, right? What's the feedback of what I'm getting through the smooth wood floor versus a floor that's rough and textured, right? Which one's going to be giving my nervous system more input? And then you can also do a comparison to hardness. So if you're standing on foam or you're standing on wood, right? They're going to give different feedback. A lot of this is going to go into shoes and footwear. If you have not heard of Stephen Robbins, I would highly recommend checking out his work. His website is actually Stephen, STEVEN, ROBBINS, MD.com. So StephenRobbinsMD.com. And he's spent a lot of his research focusing on footwear and looking at different cushion and midsoles and different stiffness of shoes and how it affects particularly baby boomer balance and proprioceptive input. So what they've seen is that if you have compromised proprioceptive input, that makes it, or it shifts you away from the automaticity of GAIT. Therefore, can we actually enhance tactile input and therefore enhance the automaticity of GAIT? That's what everything that I focus on in my practice is. Can I help my clients, can I help my patients become more subconscious in their GAIT pattern, meaning more confident, more reflexive, more fascial because of me putting them or me forcing them into a proprioceptive rich environment. Couple studies here saw that if you wear textured insoles, you actually had a decrease in prefrontal cortical activity, which is huge. That means that you just took that client out of the executive or the cognitive side of GAIT. That's massive, right? So if you have improved balance, or you can improve balance by integrating the haptic receptors in the hands, particularly in the fingertips. So by integrating either of those, thinking skin of the hands, skin of the feet, can you get them by improving their balance and taking them out of that cognitive pattern. So we're going to be augmenting tactile input to enhance the automaticity of GAIT. This is going to be a program design. What we want to focus on is having a better understanding of the skin in the bottom of the foot. For anyone who's ever heard any of my lectures, I apologize if this is redundant, but it is huge. Understanding the different proprioceptors that are in the feet is very important. A lot of people, when they think of proprioceptors, they think of GTOs, muscle spindles, those stretch reflexes, a different type of stretch reflex from the locomotion reflex, those are large nerve proprioceptors. There are also small nerve proprioceptors, which are your A beta receptors, and these are found in the skin in the bottom of the feet, the palm of the hands, and you also have many small nerve proprioceptors in your fascia. The small nerve proprioceptor that is the most populated is going to be the Pacinian corpuscle. This is the proprioceptor that is sensitive to vibration. Please note again that this is also in your fascia. So your fascia is sensitive to vibration. I'm going to speak about this in a little bit on how this ties into how I use the power plate. So understanding that small nerve proprioceptors in the hands and the feet and your fascia. Thing when it comes to nerves is that you want to think about timing, right? So any stimulus to your nervous system, it needs to be processed fast, quickly. Small nerve proprioceptors are faster than large nerve proprioceptors, which means you start stimulating those small nerve proprioceptors, you get faster feedback to the nervous system to subconsciously control shifts in GAIT. Huge, massive. okay? Your small nerve proprioceptors can be further divided into slow adapting and fast adapting. So even though small nerve proprioceptors are faster than large nerves, your small can be broken down into slow and fast. So you have the fastest of the fast, in a sense. So this is breaking them down into slow adapting, fast adapting. It also shows kind of a map on how they are in the feet, okay? What I want to show you real quick is glabrous skin is the bottom of the foot and the palm of your hand. So that's what that skin is, and then hairy skin is obviously outside of the hand and feet, okay? So the fast-acting type 2, which happens to be the Pacinian corpuscle, right? We know that that's sensitive to vibration, okay, is distributed to the ball of the foot. So when you're thinking of, think like ankle sprains, is most common ankle sprain is an inversion ankle sprain. A lot of people have ankle sprains. Probably a lot of your seniors who you're trying to reduce falls have a history of ankle sprain, which means they have just a baseline disruption in proprioceptive input to their ankle, not because of their age, but because of a history of ankle sprains. That could be a contributor as well. When it comes to ankle sprains, a majority of ankle sprains do not happen when your foot is completely flat on the ground. It is when you are on the ball of your foot and you're either taking off or you're on the ball of the foot and you're landing from a step or from a jump, okay? Which means that there's a plantar flexion element to a ankle sprain. If you can see this picture to the right, all the way to the right, FAI2, you can see all of these Pacinian corpuscles are really centered around the ball of the foot. So a key thing of how your body uses vibration detection is massive. That is the most important sensory information that's coming in. Your body uses vibration perception to know how hard you're striking the ground, because impact forces are perceived as vibration. Vibration is not just used to know how hard you're striking the ground, but vibration is used to actually maintain dynamic balance. So if you're working on balance or fall reduction with your clients, making sure that vibration is coming in is huge. That should be the foundation of your programming as well, which means you got to get them out of their shoes. You have to expose the part of the foot that is the most sensitive to vibration. So are you doing all of your balance training and your balance exercises and your proprioceptive stimulation on a completely flat foot? Are you doing anything that's building ankle and foot proprioception and stability in like a heel rise position? You should be, because that's the most vulnerable position of the ankle, okay? When it comes to plantar proprioceptors, small nerve proprioceptors, there's something that's called tuning in. A lot of people actually tune out their feet, and I challenge you to actually pay attention. And I have no idea how you would do this outside of setting an alarm on your phone or something, and just kind of think like, oh, do I actually notice my feet? Or yeah, no, until you mentioned it, I didn't even feel my feet. Yes, I'm in my shoes, but I don't feel my feet. You know, I happen to think about feet probably every other second because my career is built around feet. So I'm constantly thinking about feet. But think about your clients. Think about, I have to think about how my patients are. There's probably many times that you're just like, I wouldn't even remember that I'm standing outside of, you know, the fact that you're upright. So that is an example of you tuning out your feet. When we are chronically in shoes, your nervous system starts to detract away from different proprioceptive information if you're not using it. So what I challenge you is to develop fall reduction programming that forces your clients to tune into their feet. It is called essential noise. This essential noise is critical to helping bring that proprioceptive sensory information. The more you can bring sensory information into your client's nervous system, the more you can help them stay automatic. As soon as you start pulling away a lot of that essential noise, they switch to a more cognitive or executive side. If their prefrontal cortex does not have the room or the capacity to do executive cognitive function for GAIT, you're going to start seeing fall risk. So This is where I'm going to start talking about surface science and insoles come into play, and then of course Naboso and why I developed Naboso technology. So when it comes to surfaces, right, key thing when you're developing your fall reduction programming, are you thinking about the fact or the type of shoes that your clients might be in? Are you doing your fall reduction programming in bare feet? Are you doing it in socks? Are you doing it in thick supportive cushion shoes, or do you have more minimal shoes? Ideal environment is going to be barefoot. Socks are not barefoot. That is still a layer that has taken away the proprioceptive input from the feet. As soon as you put on your shoes, even the most minimal shoes, you enter what is called a large nerve environment, which means you are taking away the small nerve proprioceptive noise that is necessary for your clients. Next question. What surface are you standing on? Are you doing it on, your client's plush living room carpet, and then you put a yoga mat on top of that, right? What are you doing to their proprioceptive input if that's the environment that you're on? Are you doing it on a hardwood floor? Are you standing on a Bosu? I hope you're not standing on a Bosu because that does not transfer. Most important thing is that the exercises and the surface that you're choosing is going to transfer to the task at hand. So the ideal surface is going to be harder. Ideal surface, if you cannot choose one outside of where I'm going to talk about Naboso, would be a hardwood floor. To me, that's going to be the best environment because it's going to maximize the skin to surface contact. If you could integrate a texture, that would be ideal. So thinking harder surfaces, more texture is going to provide that proprioceptive input. How this plays into the way that your clients are going to actually walk is understanding how surfaces affect landing technique. Every step that they take and every foot contact is technically considered a landing technique. So softer surfaces, think like thick cushion shoes, that's a soft surface, right? Or even plush carpet, wrestling mat, right? You kind of get where I'm getting with this, right? Is going to have a longer landing phase, which actually it takes more time, right? If your client is walking at a slower speed just because of an age-related gait, and then they're in shoes, like thick supportive shoes and cushion shoes, and then they're on a softer surface, all of that is not only taking away the proprioceptive information, but it's taking way too much time because it's like they're walking in pillows, if that makes sense, right? So if you're on a stiffer surface, you have harder shoes, you're barefoot, you are going to adopt more of a stiff landing technique, which is actually more appropriate, and you can be a little bit quicker in your step. You have more information coming in, which is key. So I'm going to talk real quick about Naboso. Naboso is a barefoot training material that I developed. It took me the last 2 years to develop and actually get this material to the way that I needed it to be, to maximize small nerve proprioceptive information. This is based on research. Very important that any of the textured research that I ever reference was used to build this and design this technology. It is a yoga mat size. It is not necessarily a yoga mat because it's used for anything, clinical, rehab, bath mats, outside, when they wake up in the morning, children, seniors, Pilates classes, there's every application. So think of this more as a surface, not quote, quote, yoga mat, okay? It is made of TPE on top, TPR on the bottom. It has a very specific evidence-based texture design to match the insoles that were used in a lot of this textured research. We are seeing same control in posture, decrease in medial lateral sway, higher deep core activation, better control of gait parameters, decreased knee arthritis symptoms, etc., because we're trying to enhance this from a neuromuscular perspective. We have insoles that are coming out as well, and these insoles integrate the exact same technology. Most of the research when it comes around textures was based around insoles, and then we took that information and developed the mat, and then we have a flooring system as well. There is, and I'm going to mention this again at the end, but we're doing discount for anyone on FAI, but I want to talk about the science first because I don't want it to seem like just throwing this mat at you. There's a science behind it. My goal through this science, whether it's the insoles or the mat or the flooring, is to help your clients reduce falls. The most important thing. When we look at textured insoles, this is not specific to fall reduction, but we can see here that this has to do with inversion control, so proprioceptive control. If you put textured insoles into shoes, this happened to be with dancers, they saw that there was a faster inversion moment detection when they used the textured insoles. The faster that you can detect that inversion moment, the more protected your lateral ankle will be, which means the more protected you will be from spraining your ankle, from falls, etc. Okay? So textured insoles, this is interesting, textured insoles were worn not during their dance time, but they used textured insoles during their day-to-day activity. And then they danced, and they still saw increased proprioceptive awareness of the ankles. So you get a transfer. That is huge, which means if you train on the Naboso mat, and then your client goes into their shoes and they happen to not have the textured insoles, they will still have a protected response, which is key. They also saw, if you put textured insoles more from a performance side, with the football cleats, is they actually had same thing, faster ankle inversion moments, and they actually saw higher force. So kicking force was higher. When you look at textured insoles and GAIT parameters, this is also very, very interesting, is that they saw changes in ankle angle. Anytime you decrease or you change the ankle angle at heel strike, you're actually decreasing impact forces that are coming in. They also saw a shift in the time to peak of impact when they wore the textured insole. This is similar to what I saw in myself when I used the textured insoles, as I started to notice that I was striking the ground a lot softer. And my right knee, I've had a scope and arthritis and all this stuff from athletics. And when I use the textured insoles, I actually noticed that I walk much softer. My movement accuracy when I'm walking is much better when I use the textured insoles. And then that translates not just to fall reduction and balance, but to other joints, knee joint, hip joint, etc. Couple more slides that I want to run through real quick. When we're talking about vibration, because vibration is the most important proprioceptive input coming in outside of the texture that we spoke about, this is where you can start to integrate power plate or whole body vibration. I actually work with power plate with Naboso because it's proprioceptive, and my goal is not just doing static balance training, but the whole body vibration platform can mimic an unstable environment while maintaining stability. So it's great for your seniors. The vibrations is also amazing for building bone density. That's another side of vibration that is outside of just balance and stability, is that vibration stimulates the insulin-like growth factor, which stimulates your bones and your connective tissue health. So there's other great benefits. And it also leads to higher co-activation patterns, which is great. Last thing that I want to add in here, outside of our feet, because our feet are obviously very powerful, is you cannot forget about the haptic receptors in your hands. If you stimulate the skin in your hands, specifically the fingertips, you will notice an increase in your postural control. So when you are doing fall reduction programming with your clients, think about integrating something in their hand. If they're next to a wall or a chair, they can just lightly touch the wall or chair, and that will improve their postural control or decrease their medial lateral sway without them having to like hold on to the chair. This is also when they are actually walking around, is you can have them hold something in their hand. I feel like everyone holds like a phone in their hand now, which is probably stimulating their nervous system outside of the radiation of the phone, but it's stimulating a closed loop pattern. And why I would recommend or possibly encourage you to assess your clients for this is that navigating a cane. A lot of people will use a cane, and a cane, from the fact that the cane is in the hand, stimulates the proprioceptors of the hand, which therefore improves stability. However, navigating a cane can sometimes throw them off because that makes them cognitive trying to navigate that cane. So weigh the risks of something else in the hand, not the cane, because the cane isn't really providing the mechanical stability. It's the proprioceptive stability that the cane is allowing. So something for you to think about, especially with some of those clients who don't really need the cane. It's more of a fear of falling that they're using the cane, so they feel more confident. I would encourage you. Okay. Last thing, when we go into our rehabilitation of enhancing automaticity, most important thing is repetition. Repetition, 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 and that your task must be specific. So we want to make sure that we are repeatedly activating the nervous system in the way that's going to transfer to GAIT. This is called activity-dependent plasticity, and understanding that sensory must precede cognitive. So make sure that you're thinking about what's happening to the footwear that you're using, to the surfaces that you're standing on. Are you integrating any stimulus to the hands? Are you tapping into their fascial system? Get all of that proprioceptive sensory side of things covered before you start throwing the dual tasking side of fall reduction at them. And I'm almost certain that you're going to see better results to any sort of fall reduction dual tasking programming that you have. So again, we have the Naboso, we have the discount. You may go to nabosotechnology.com if you want to learn more about Naboso and our insoles. Our insoles are coming out in the summer 2017. We have a mailing list for anyone who wants to get the insoles under the first batch that gets shipped. You can just contact us at nabosotechnology.com. We'll add your name to the list. And super excited to be sharing this information with you guys. If you have any questions, please reach out, type those in, and I think Dan's going to help me go through those.
Yeah, thanks so much. That was fascinating stuff, and definitely want to check out that Naboso for my facility. We've got quite a few questions here, so I'm going to fire a bunch at you, and I'm sure we'll have a bunch more come in. So first question from Karen. I think a couple other people were wondering this too. Are your slides going to be made available? Would you provide those?
Yes, absolutely. I always make my slides available. There's two options. You can email me at education@ebfafitness.com. That's actually not typed on there, sorry. ebfafitness.com. education@ebfafitness.com, and then I can also get a copy to Celia at FAI.
Okay, great. And then Karen also asked, so a client with diabetic neuropathy and Parkinson's disease could still benefit from textured insoles?
Yes. So key thing so I'm probably one of the only podiatrists or few podiatrists who tells diabetics with neuropathy to get out of their shoes, which I'm sure anyone who's listening and they have clients or patients who have diabetic neuropathy, the biggest fear is, that they're going to step on something, they're going to get some infection. Don't ever go without your shoes. Most diabetic neuropathy, and especially initial diabetic neuropathy, is sensory. It's actually not motor. Some of it can progress to start affecting the intrinsic muscles and etc. However, there's a benefit to barefoot training that is also motor. So when you're doing barefoot movement, even though you can't necessarily feel your foot is contracting to maintain balance, your foot is contracting to absorb impact forces, and your foot intrinsics are myofascially connected to your pelvic floor. And diabetics with neuropathy, because they cannot feel their feet, they have to use their thoracolumbar fascia as their sensory input system for shifts in their center of gravity. So learning how to tap into the pelvic floor through the feet is huge for a diabetic because again, as I mentioned, they have to go into a more proximal strategy. We go into that a lot in our certifications, and it's really one of the most important things for a diabetic with neuropathies to still get out of their shoes and still challenge those peripheral nerves. And the power plate is great for them. And then there's vitamin supplementation, which can actually increase nerve growth factor. That's huge as well.
Okay, great. Marcia's asking about the material of the mat. Is the material latex free? Curious about latex allergies.
Yes, absolutely. There is no latex. It's not no parabens in it. It's toxic free. I made sure that environmentally it's going to be safe, and there's no petroleum. I also get to ask that a lot. There's no petroleum in it.
It doesn't smell like gasoline when you roll it out?
No, it doesn't smell like gas. So it is recycled rubber. So there's the whole like non-toxic environmental side to it. So rest assured with that. But that is a very good question. And in medicine, I would not use latex.
Ruth Schrader Grace is asking, as a fitness coach, I pay close attention to my clients' feet, especially teaching suspension training. I train my clients on a 3/4 inch, 2 foot by 2 foot connective mat. It's sturdy, but yet soft enough to prevent injury. What is your take on this kind of flooring?
What's the material of it?
She says it's a 3/4 inch, 2 foot by 2 foot connective mat.
3/4 inch. You know what? I would need to know the hardness of it. You know, you're honestly balancing proprioception with, okay, if they fall and they hit their head, like, you know, like you got to balance those things. So if you're on a surface that's softer like that, so let's say you have to use that, totally fine. I would just make sure that you're doing it barefoot. If you have that surface and then you have them in their cushioned shoes, that's just even more barrier. You know, a 3-inch mat is actually really thick, but I understand that you're trying to avoid injuries.
It's a 3/4 inch, just 3/4 inch.
Oh, 3/4. Oh, I thought 3 inch. I was like, well,
yeah, no, 3/4. It's pretty thin. Pretty thin.
Yeah. So then, yeah, knowing the hardness, I would always say balance. If you're going with a mat, go barefoot.
Okay. Okay, we got some price negotiation questions coming in. So Dina asks, will she negotiate wholesale pricing so that we can sell to our clients? I would totally offer the insoles direct to sell to her clients.
Well, guess what? We actually have wholesale pricing. So
all right.
So there you go. Just email me or contact me through Naboso, and 100% we have the pricing already set up. So.
Okay, great. So do you see trainers selling the mat and the insoles to their clients, or just the insoles, or both, or what?
No,
what do you think?
both. We actually have quite a few of, we'll call them soft distributors of the Naboso mat, and the mat, just since the can of worm was open here, the mat retails for 110 US, and we wholesale it for 60. So if you price them there. But again, it's a modality. It's a surface. It's not like a $20 Gaiam mat. You know, there's definitely some technology in the mat. And I know Cody saw it. I don't know if you saw it, Dan.
No, I have not seen it yet. Yeah, Cody's seen it. I have not. So.
You have to get you guys one.
Yep. So another question. So if I'm training 4, 6, 8 clients, and I don't really have the space to roll out, you know, this size of mat, do you suggest cutting these into smaller sizes? Are you going to be coming out with sizes that are more like an Eric's pad size? What are your thoughts on that?
Yeah, so what we do, and, you know, yes, our goal is to have, you know, different products that are out there. You can have, you know, several people on one, or even lay them out, so it's kind of like a faux flooring in a sense.
Gotcha.
But technically it can be cut.
Okay, so you could roll it out and have 3 people get on it, or you could cut it into different pieces. Okay. Robin is asking, what do you think of cobblestone walkway flooring?
That's actually a very good way. What you're doing, that's a form of trigger point release or acupressure, reflexology, so kind of more along that side, which is actually great. There's some research that has shown 5 minutes of trigger point release. I have my patients do it on a golf ball, but you could absolutely have them stand or walk on a cobble pathway or different stones. Doing that 5 minutes, they saw an immediate improvement in balance, which is huge. So doing that at the beginning of your fall reduction program is what I would do, because you're starting them off on the right foot, no pun intended.
Okay, we got a bunch more questions coming in. We're going to go 10 more minutes because I want to honor your time and everybody else's. So if you've got a question, you better get it in fast. We'll see how many more Dr. Emily can get through. Suzette asks, studies done on textured insoles, were they done with aging participants, any with people over the age of 70?
Yep, actually both. So if you go to Naboso, we actually have the textured research on there, and then I have a bunch of textured research on barefootstrongblog.com. You will find textured research in young individuals, healthy older individuals, cerebral palsy, Parkinson's, MS, post-stroke, and then performance. So you actually find a very wide variety of textured research.
Okay. Juan is asking, what about clients with arthritis in their feet?
Yes. So that's part of the reality of seniors, right, is can every senior go completely barefoot? And that's partly why I had developed the insoles, is that some of your clients just will not be able to get barefoot. You know, they have fat pad atrophy, their skin is very thin, they have arthritis in their joints. So there's a reality side to baby boomer fitness, especially from a barefoot training perspective. For those who cannot get completely barefoot for any of those reasons, releasing the feet on a golf ball, lacrosse ball, something, and then putting their shoes on, or if in them they have to use socks, right? So we kind of find that happy medium. If they still can't go barefoot and we do the shoes, could we use a textured insole to keep the information? You know, it's really finding what works the best, understanding and respecting that not everyone can get completely barefoot. We get them as close to barefoot as we can, and then work with those that we can't.
Okay, sure. Okay, question on orthotics. Somebody's saying that they learned in massage therapy school that orthotics are a crutch, and they actually ditched their orthotics. They're not wearing them currently, and they're curious your opinion on the notion that orthotics are actually just a crutch.
Yes. So good job for getting rid of your orthotics. Actually, again, I'm probably one of the few podiatrists that does not push patients into orthotics. I actually get patients out of orthotics. I want my patients in as natural footwear as possible. I want them doing barefoot training, tapping into their natural strength. So when I do use orthotics, I will use them oftentimes in a transient state, meaning I'm using them to get a patient into a quiescent state in whatever their pain condition could be. And then once I get things under control from a pain perspective, then I can start to strengthen the foot, strengthen the nervous system, strengthen the fascial system and whatnot. So I definitely do not push them. Do some people need them, like actually need them? Yes. So we want to understand both sides, but to just use them, you know, from the go, thinking that we quote unquote need support for our feet is a huge misconception that unfortunately is taught a lot in schools.
Okay. Sharon's got two questions for you. Going barefoot for a client who shuffles, can that be improved with your mat? And then supplements, vitamins, which ones encourage nerve growth?
Yes. So with the shuffling, key thing that I would look at for you in this particular client is, yes, they can do barefoot training. Let's say they're shuffling. As soon as I hear that someone is shuffling, I'm going to start thinking that they have insufficient ankle mobility and insufficient great toe mobility, which means those joints may be completely fused. It's quite possible, right? They might have really bad arthritis in those two joints, and then they just don't have the mobility in the foot. If that's the case, then you can still do barefoot training. You're just doing it statically, or you're having them stand and do different exercises, whatever those exercises might be. They can still do a single leg stance. They can still do hip hinge type movements to still get the proprioceptive stimulation, even though they can't move their ankle or great toe. If they can't move their ankle and their great toe, or one or the other, then you have to look at what's causing them to start shuffling. It's probably a fear of falling. Maybe they've fallen in the past, but if they don't have that mobility and they're shuffling, you're not going to get that mobility back in those joints. So it's kind of a longer answer on that. We go into a lot of that in our education, so I encourage you to check that out. And then with the supplements, particularly for nerve health, there's several. The best ones are L-methylfolate, which is an activated form of folic acid. There is R-lipoic acid is a very good one. That's particularly for diabetics. You want to make sure that it's the R form of lipoic acid. Don't do alpha lipoic. It needs to be R-lipoic. Acetyl-L-carnitine is great as well. There's a prescription nerve supplement called Metanex, METANX. That's natural prescription. It's FDA approved for diabetic neuropathy. That's a supplement as well. And there's several other ones. I go into a lot of this. I have a book called Barefoot Strong. I go into that. But I would say the most powerful one is that L-methylfolate, which is a B vitamin, right? So
Okay.
B vitamin for nerve health.
Okay. Jennifer's asking about nerve damage. So for clients who've had nerve damage where the nerves haven't grown back yet but are expected to, is there any evidence that barefoot training will help stimulate the nerve growth?
Does she know which nerve?
Jennifer, do you know which nerve?
If she doesn't, hopefully she hasn't left the conversation.
Yeah,
but
right.
Let's say it's the, I'm just going to answer this in a hypothetical way then. Let's say it's the perineal nerve. I'm just saying. Like, let's say she had a cast on and it was too tight and it started to cause like a little foot drop because of the perineal nerve having pressure on it. It can take, from a minor injury, it can take 6 to 8 weeks for the function to come back, totally normal. The most important focus during that time, say that 6 weeks, is anti-inflammatory, huge. I would do any of those nerve protective supplements that we just spoke about. That's huge. I would do some sort of class 4 laser to the nerve if you can. I would do the whole body vibration or power plate to it as well. That's for sure what I would do. If it's not that minor one and it's something that you're talking like 6 months out, then you would really continue doing the exact same thing, but past this point of 2 months, so the 2 months is really you're controlling the inflammation. Do not stress it. Do not use the nerve or the foot. If it's foot drop, I'm just kind of guessing that that's what it is. Do not start doing exercises to strengthen the foot when you're in the super acute phase of it, meaning 6 to 8 weeks. After those 8 weeks, then you can start to push the nerve to try to start to get some sort of like collateral nerve stimulation, and that's where you could do concentric, eccentric, isometric muscle activation techniques, but I would not do that for the first 2 months.
Okay. So Pam asked, what kind of changes should a client expect to see and in what time frame after using this mat?
So a lot of people actually feel it right away. They'll feel more confident standing. A lot of people will feel like a little electricity in their feet. And that's the way that's been explained by quite a few people, that they get more out of their exercises. They feel like their balance is better on the mat. With the textured insoles, a lot of people actually feel more stable. They feel decreased sensitivity to their knee joints. Other subjective ones, particularly with fall reduction, is your clients might feel more confident as far as walking, right? That's a very subjective. They might feel like their coordination during GAIT is a little bit higher. And then for those who use it not for fall reduction, the mats particularly, they actually feel like they're stronger. So to the extreme of people do Olympic lifting on it, you know, people do kettlebells. People do feel stronger. Key thing, like last note related to the mat, is that it's a proprioceptive mat. So it's tapping in the exact same way that thinking like kinesiology tape works, or myofascial release works, or whole body vibration works, right? They're proprioceptive, which means they're subtle but massively powerful.
Okay, last question because we're out of time here. Naboso technology as it relates to plantar fasciitis.
So I look at plantar fasciitis as an impact-related injury, which means that most impact-related injuries, again, this is the way that I look at it with my patients, is caused by a delay in your loading response. And a lot of times the delay in the loading response could be because you're tuned out of your feet. The more tuned in you are with your feet, the more controlled your initial contact is, and then the faster your loading response would be. So that's how I would address plantar fasciitis from a proprioceptive perspective, whether it's Naboso or barefoot training. To me, the timing of the foot is the most important thing. Shoes create a barrier and make your feet slow, make your nervous system slow. So whether it's barefoot or it's Naboso mat or insoles or whatnot, minimal footwear, that's really how they're working, is from a proprioceptive perspective.
Okay. Well, Dr. Emily, thanks so much for all your time. And if folks still have more questions for you, obviously they can go to the website there and check out the mat, and they can also go to ebfaglobal.com. And I know you said you'd make the slides available, and people know how to track Celia down as well if they're looking for your slide deck. So thanks again for doing this for us.
Of course. Thanks everyone again for tuning in.
So long, everyone.